Hey everyone, good day to all. Hope you are guys doing well. Myself, Dr. AJ Moria. Today I'm going to discuss guys some important images in the surgery, guys. Okay, guys, surgery. Like there is 50, there is 30 items in the exams. And 30 items, guys. Like 50 items. 15 items will be very easy, and the 15 will be is like a clinical orientation. Okay, now like at the last exam they give almost all the images. Okay, now from they are the live images. Okay, now so let's see some important images. And also here in Telegram group, guys, I am conducting the quizzes and the live discussion every day. You can also join in the Telegram. Just search FMG Aspects AJ in the Telegram. Also, I will keep the link description. Okay, for the PDF also, I will keep the link in the description. Okay, let's go. So, guys, next first one, guys, we are going with the thyroid. So guys, this is the thyroglossal cyst. Thyroglossal cyst here. It is the midline. And always occur in the midline. It moves with the deglutition. It moves with the deglutition. Deglutition. Okay, now this is the case of the thyroglossal cyst. Okay, now and also guys, what is the surgery? It is the cyst trunk surgery. This cyst trunk surgery. Okay, now here for the thyroglossal fistula also guys there is a surgery is the cyst trunk surgery. And please remember here it is always an acquired condition due to rupture rupture or in the incision anterior of the thyroglossal cyst. Na? It occurs. It is always acquired. This is the congenital, but this is not the congenital is always an acquired condition. Surgery will be the cyst trunk also. Okay, na? Remember here, this is the ectopic. This is the here. This is the ectopic thyroid tissue on the tongue. It's called the lingual ectopic thyroid. Thyroid will be present at the somewhere. Okay, here. This is the okay. The treatment of choice will be the radioactive iodine therapy. Okay, na? Radioactive iodine therapy, or also you can give the levothyroxine. Remember here. Next one, guys, this is the branchial. This is the branchial cyst. This is the branchial cyst, guys, and this is the cystic hygroma. Branchial cyst, guys, it is the anterolateral limb. The anterolateral neck swelling along with the anterior border of the sternocleidomastoid mastoid. See here, this is the anterolateral. Okay, this is the remnant of the second brachial cleft. This is also the remnant of the second brachial cleft, but it is the posterolateral. It is the posterolateral neck swelling. Okay, this is the posterolateral neck swelling, and also there is a trans illumination test positive. Trans illumination test positive. Okay, na? Can you tell me the in surgery, guys, in what cases you will see the trans illumination test positive? Just comment in the section. Comment section, guys. Okay, now this is the due to the lymphatic channel blockage. Okay, now so guys, this is the Ludwig angina. Ludwig's angina. It is the here the swelling. This is the bull snake types. Also, there is a infection of the floor of the mouth, and also there with the history of the dental caries. Okay, na? Dental caries in the case of the Ludwig angina. Got it? Next one, let's see here. This is the esophageal candidiasis. Candida albicans is the most common cause fungal infection. Guys. Here the drug of choice will be the fluconazole. Fluconazole 150 milligrams 2 to 3 for 2 to 3 weeks. Okay. It is high risk in patients like immunocompromised patient with HIV and AIDS, chemotherapy patient. Okay, now. And this one, guys, is the eosinophilia. This is the more eosinophils due to the atopic, guys. It's called as the eosinophilic esophagitis. Okay. Also, guys, this is the oral hairy leukoplakia. What is the meaning of leukoplakia? What is leuko? Leuko means what? It's like a white blood cells, like okay, it's like a white. Leuko means white. Plakia means patch. It's a white patch. It's a oral hairy tag. Hairy tag. It is a oral hairy here. Oral hairy leukoplakia due to the fungal infection, guys. This is the leukoplakia. This is the leuko. This is the, it's like hairy. That's why hairy. This is not hairy. That's why it's the only, there is a only white patches here. This is only the leukoplakia. This is the erythro. This is the erythro means this is a red color patches. The erythroplakia. Okay. The next one is the comes the breast, guys. Okay, now so here this is the most important is the fibroadenoma of the breast. It is seen in the, see, you can see here, guys. This is on the histopathology. Okay, so on the histopathology there is a compressed sit silt like glandular tissue. Okay, now you see compressed, like on the see, guys, on the mammography we will see what there is a Mickey Mouse, there is a mouse like masses. Okay, there is a calcification, there is a calcified. Here we'll see the history. They will give the patient will be the age of the up to 18 to 25, 18 to 25 within the range, and she will tell that there is something moving like a mouse. Okay, now fibroadenoma is also called as Mickey Mouse of the breast. Okay, na? See here, this is the PUD orange. Okay, this is the PUD orange due to the lymphatic blockage. This is the T4 T4B TNM staging. Okay, na? This is the T4B TNM staging. This is the breast abscess. Because it's a bacterial infection, guys. So you have to do the IND and you have to followed by the antibiotics, guys. Okay, this is the case of the Paget's. This is of the nipple. This is the superficial manifestation of an underlying malignancy, guys. Okay, you have to, first of all, this is due to the, if there is any if the patient is having the malignancy, it will cause this. There is a unilateral eczema like the condition of the nipple. Treatment will be the, first of all, you have to treat the underlying malignancy. Okay, now. Next one is the, see here, this is the TNM staging, guys. You have to remember that they will give like a case based. Okay, now. Suppose the size is more than 5 centimeter. It is the T3. See, it is the T4A. It means that it is whenever there is a whenever there is a chest involvement, the chest involvement. Okay, na? T for B, T for B, it is the PD orange. Okay, na? T for D is the inflammatory. Okay, na? Inflammatory. Please remember, guys. At least remember the difference between the T for B and T for D. Okay. Okay, na? And see here, this is the classification of the carcinoma of the breast, guys. See here, these are the luminal A, luminal B. So here the luminal A and luminal B, it means the ERPR positive, and there is a in the HER2 in the luminal A and luminal B, ERPR positive. But difference is that HER2 in luminal A there is a HER2 negative, but luminal B is a HER2 positive. That's why here HER2 negative is the best prognosis, the positive is the bad prognosis. Okay, coming to the here luminal 3, guys, luminal 2 here, luminal 2 A and B, luminal 3 here. Okay, luminal A1, luminal 2, this is luminal 3, guys. This is HER2. This is the C, this is the, there is a HER2 positive, but there is a ERPR negative. ERPR negative. This is the bad prognosis. Okay, now. So this is the fourth one is the basal one. There is a triple negative. There is a BRCA1 positive. Okay, now sometimes they will give as the they will give condition like there is a triple negative. This is the basal. Okay. So here is the types of the breast cancer, guys. You have to remember this is the lobular carcinoma. This is the invasive lobular carcinoma. You'll see here the Indian file-like pattern. Okay, in the seen in the due to the deposition of due to the loss of the E cadherin. This is the loss of the E cadherin. We'll see the Indian file-like part in the case of the invasive lobular carcinoma, guys. We'll see the non-invasive. This is invasive. Ductal carcinoma is the most common type, is in the non-invasive, and this is the best prognosis from this is the ductal. See, the ductal carcinoma in situ is the most common cause for the non-invasive. That is the ductal carcinoma is most common in the from the invasive carcinoma. Okay, now best prognosis is the tubular. Inflammatory is the worst prognosis. Just remember this one, guys. For remember, guys, this is the from the for the chemotherapy, guys. For the pre-menstruation women, you have to give the tamoxifen, and for the post-menstruation, guys, you have to the aromatase inhibitors like letrozole, anastrozole, and also the exemestane. Okay, now remember this one. Here, guys, this is the case of the intersection. This is the current jelly. This is the current jelly legs. This is the current jelly. See, guys, current jelly. They ask the current jelly stool. This is the current jelly stool. Okay, na? Current jelly stool. It's the case of the into susception. Into susception. If they ask you guys into susception, if they ask you guys ask your current jelly, what are current jelly? Current jelly sputum. There is case of the Klebsiella pneumonia. This is the Klebsiella pneumonia. Okay, na? Just remember, you have the target sign here. You will see the target sign here. You also see the dancing sign here. The empty right iliac fossa, guys. And also here you can see the so guys, they are the signs and symptoms. They are the signs and symptoms of the intussusception. Okay, na? Please remember, guys. These are the and remember here, guys. I think you will know about this one types of wound. It's clean, contaminated, dirty. Okay, na? Just remember this one. Please see here, guys. We are having the types of the ulcers. We are having the healing ulcers. It is the sloping ulcer, punched out ulcer, there's a undermined ulcer, rolled out ulcer, and the aortic ulcer. You can see here, guys, sloping or a healing ulcer. It is the venous ulcer. Guys, how to remember remember the is it venous or arterial? Remember, guys, venous. Venous means it is the superficial only is the venous. Na arteries are located deeply. That's why see here arterial deeply. That's why there is a deep cut, deep ulcer here. This is the superficial. See the sloping or healing. This is the venous ulcer. So punched out means this is arterial ulcer. Okay, now this is the undermine. This is the chancroid or pyoderma gangrenous. Roller also is example of the basal cell carcinoma. Okay, na aorted. This is the aorted is case of the marginal. This is the marginal ulcer. Marginal ulcer. It is the having the history of the burn. This is the burn. Okay, na burns here. Remember, this is a trophic ulcer seen in the diabetic mellitus and also this in the leprosy cases. Okay, now remember, guys. So these are the I told you that this is the superficial, it is the venous ulcer sloping. This is the punctured out. This is the arterial ulcer, neuropathic ulcer. This is the pressure ulcer. This is the marginal ulcer related to the burn history. Okay, also see here. This is the case of the varicose vein. This is the varicose vein. Okay, that Daplographia. Okay, now you have to do that one. Okay, so what is the treatment? Is that you can give the CCB or else you can give the stockings. Okay, na stockings for that treatment. Okay, na this is the pneumatic compression stocking here for this one for like varicose vein. This is the negative pressure wound therapy. Remember, guys, this is the Mentrias diseases here. Just remember here, this was the so guys, this is the CDS. This is the congenital diaphragmatic hernia. You can see the scaphoid abdomen. You can clearly see that there in the chest area there is a bowel loops. There is a bowel loops here. You can find that's why it is you can see the bowel loops in the thorax. Okay, na. So you can see this is the called as scaphoid abdomen. Scaphoid abdomen. Remember that in the congenital diaphragmatic hernia, guys. What is avoided? We have to avoid the bag and mask ventilation is avoided. We can do the Nissen's fundoplication. Okay, na Nissen's fundoplication for the congenital diaphragmatic hernia. Okay, na this is the case of the here tracheoesophageal fistula with the esophageal atresia. So guys, from this one, guys, just remember the type C. Type C is the most common. This is the type C is the most common. Just remember one thing from here, okay? Also, guys, remember that from the differences between the Crohn's and the ulcerative colitis. Crohn's, it causes the any part. It affects the any part. Like the any part, especially the terminal ileum. But the ulcerative colitis is the It is the rectosigmoid. Okay, na? Just please remember, please study this table. We'll get the one question and also the string of sign. This is the string sign. Lead pipe is seen in the ulcerative colitis. Okay, na? Cobblestone stone is seen in the. This is the cobblestone seen in the Crohn's. This is pseudo polyps seen in the ulcerative colitis. Remember, guys, here. Yeah, this one, guys. String here. Lead pipe here is seen in the ulcerative colitis. Okay. Lead pipe seen in the ulcerative colitis. This is the string of Cantor seen in the Crohn's, seen in the ulcerative colitis. Okay. This is the pseudo polyps in the colitis. This is the cobblestone stoning in the Crohn's disease. This is the diverticulitis. Please remember, guys, this is also we having the gastric ulcer and the duodenal ulcer. Gastric ulcers, duodenal ulcers. Okay, now please stop the please pause the video and just you can just have the know the difference between the gastric ulcer and the duodenal ulcer. Okay, now. But what is the here important is the you have to know that which article is the most common is the bleeding in the site. Okay, remember the differences. Also, guys, as you know that this is the chips. HPS is the congenital hypertrophic pyloric stone. Here, what happens is that there is a hypertrophy of the hypertrophy of the what? Pyloric gland. Okay, pylorus. That's why they will tell the history like that one. There is a non-bilious vomiting. Okay, this is the single bubble sign. Then the here, this is the double bubble sign, duodenal atresia, triple bubble signs in the jejunal atresia, multiple bubble signs in the ileal atresia. Okay, na? Remember these images, guys. Okay. Done. Next one, guys. I think after the appearance here. This one, guys, this is the ischemic colitis. This is the thumbprint sign. This is the pseudomembranous colitis. This is in the case of the is also the in the thumbprint sign. Okay, now the gastric ulcer. There is a filling defects. Gastric ulcers. This is, guys, pulled up cecum. This is the pulled up cecum. See in the ileocecal tuberculosis here. Goose neck deformity here. This is the husband, guys. This is the husband disease. Remember here, husband disease, guys. This is they will give the history like this one, like a baby is not passing the stool after 48 hours. Okay, na? Okay, na? It is due to what? It is due to the A ganglion. This is the A ganglion. This is the absence of the autonomic nervous system. Okay, na? In the colon, the dilated proximal and the colas distal segment of the colon here. Remember here that this is the esophageal. This is what is the ring called? The ring is called the esophageal Satsky ring here. This is the juncus diverticulum. This is the juncus diverticulum, guys. This is between the inferior constrictor. This is the between the thyropharynges and the cricopharynges. Okay, thyro and cricopharynges. Okay, na? The juncus diverticulum. It is between the in the area is the caisson. This is the caissons. Dehiscence. Okay, Kehan's dehiscence. Okay, this is the Kehan's dehiscence. Okay, now it is between the thyro and the cricopharynges. This is the toxic megacolon. This is the toxic megacolon. Yeah, everything around with the ulcerative colitis here. This is the apple core lesion seen in the colon cancer here. Apple core lesion is the apple core lesion. Remember, this is the pneumoperitoneum. This is the pneumoperitoneum. This is the cupula sign. You can see the cupula sign and also called as meniscus sign. What is the treatment? It is the intraoperative. Is you have to do the laparotomy. Emergency laparotomy. You can see here the generalized peritonitis. See the bubble like appearance. This is case of the peritonitis. See, guys, here this is the eclasia cardia. This is Berg big sign. See, guys, here. Remember, guys, here the eclasia cardia, bird big sign. See here, if you see bird big sign, eclasia cardia. on the barium swallow. On the barium swallow, if you see there is a bird beak sign, this is the case of the achalasia cardia. If you see the achalasia cardia, so if you see the bird beak sign on the barium enema, then it is case of the sigmoid volvulus. Remember, guys, this is seen in the barium enema. Barium enema. This is seen in the barium swallow. Okay. In the both cases, we will see the Brodvig sign, but the difference is the contrast media. It is the achalasia cardia is in the swallow, barium swallow, segment volvulus is in the barium enema. This is the guy, sister Joseph nodule, sister Joseph nodule. This is the metastatic of the gastric and the cyst. Okay, na? We follow the Witch's node. Also with just node or process sign of the most commonly in the left supraclavicular node, lymph node. This is the incisions in the abdominal surgery, guys. Please remember, last time also there is one question. This is the lange. So lange incision typically used to for the appendectomy, guys. Last time the same picture is given. They marked here. Huh? Lange is important, guys. This is also the Gritson's incision, the McBone incision, classically for the appendectomy. Guys, always they asking the appendectomy. Remember the one we have the Lange and the McBone, also called as gradient. These are called as gradient incision. Okay. Coaches, I think everyone knows about the coaches for the cholecystectomy. Okay, na? Remember these guys. At least remember these two. This is the stoma. Stoma is for the colostomy, guys. During the colon cancer, guys, treatment. Just they are going to open some openings. It's called the stoma. Just they are going to put the colostomy bag where the all the fecal matter will be coming out. Okay, it's called the colostomy. In the colostomy, stoma means, guys, is the opening. Okay, this is the modified Blair incision. Modified Blair incision done for the paratidectomy. Hernia, guys, remember, guys, this is the hernia of FMGE. This is one. There is a mesh repair. This is the prolin. The prolin. This is the umbilical hernia, guys. Here are different types. This is the epigastric hernia, umbilical hernia, incisional hernia, femoral hernia, and inguinal hernia, guys. Just please remember here. Remember, guys, here coming to this from the hernia topic, guys, there are going to be the one question. Okay, na? From the hernia, guys, this is the hernia. What it means? What is the protrusion of the viscous or part of the through the wall content? See here, guys, we are in the indirect and the direct hernia. See, what is the most common type of hernia? It is the indirect. The most common type of hernia is the indirect hernia. In elderly, direct hernia. In the females, guys, they are asking what is the most common type of hernia in the females. In the case of it is the indirect hernia. Most common hernia in the females is the indirect hernia. But if they ask you what is the most if they ask you femoral hernia is most common in, then you have to mark the females. Okay, now see the most common type of See, no. See, the most common type of hernia in the females is the indirect hernia. If they ask you, femoral hernia is more common in, okay, na? Then in the case of the females. If they particularly mention the femoral hernia, then you have to mark the females. Okay, na? Otherwise, if they ask you what the most common hernia, it is the indirect hernia. Okay, na? Okay, na? Remember, guys, here this is the difference between the indirect also directly. Yes, indirect is the young adults. This is the elderly. Elderly is a direct hernia. You have to how we are going to differentiate, guys. This is guys the pass. This is the passes by the deep inguinal ring. This is the from the Hasselbalch triangle. Guys. Okay, na? Okay, na? I think everyone knows about the guys the landmarks how we are going to distinguish from the direct and the indirect hernia. If they get directly to if they are going to directly passing through the Hasselbalch triangle, guys, this is the case of direct hernia. If they are going to See here. See from the see here. Direct and indirect hernia it can be differentiated by by inferior epigastric vessels. Inferior epigastric vessel. Please guys remember this one, guys. This is always they asking one question from this one, guys. Okay, now here I think everyone knows about the Hasselblad triangle, guys. Okay, now if the England ligament is passing through the Hasselblad triangle, the direct hernia, sidebar, this is the indirect hernia. Also remember, this is the NHYUS classification. If they mention it is 3A, 3B, or 3C, or 4, it is the 4 it is a recurrent. 3A, it is the direct one. Okay, na? I think everyone knows about this one. This is the guy. This is the omphalocele. This is the omphalocele, guys. Remember, my mnemonic is a omphalocele seal. Omphalocele seal means shield. Omphalo means it is the shield. It means all the herniated structures are shield, are packed here. Okay, na? See, omphalocele, omphalocele. L means liver. The contents are the what? It is the liver. Okay, now here are liver, and there we are having the here the small intestine here, gut here. But here the gastroschisis is the opposite. It is not having the any sac to cover. Okay, na? The gastroschisis. This is how you have to remember. See here, this is the case of the see here the in the open surgery, guys. In the open surgery during the while we are doing the first surgery for the hernia, guys, we have to put the you see, guys, for the open surgery also called as Lichtenstein's or Lichtenstein free Lichtenstein tension free mesh hernioplasty. Okay, na? It is if you while in the open surgery, guys, the most common nerve injury is the ilioinguinal nerve. The ilioinguinal nerve. Okay, na? For the laparoscopic, guys, surgery, it is the lateral cutaneous nerve or the thigh. It causes the meralgia parastatica. Okay, na? For the congenital hernia, guys, you have to do by after 3 years. After 3 years, it is the herniotomy. Remember this one, guys. Okay, na? Please remember this one. And also, guys, see the types of the hemorrhoids. Hemorrhoids are due to what? Due to so this is the venous bleeding. Okay, na? Venous bleeding. Okay, na? Hemorrhoids here. Superficial venous bleeding here. You see, this is the first degree. There is no prolapse, just a prominent blood vessels. Okay, there is a second degree of prolapse upon bear down, but spontaneously reduced here. See, this is third degree. This is the fourth degree, guys. Prolapse and can be manually reduced here. Let's remember the hemorrhoids. This is the what? Superficial. This is the venous blood vessels. This is the dilation of the venous blood vessels. There is a bleeding. The hemorrhoids here. This is the fistulo-anal. There is a connection between the one and two structures. This is the fistulo-anal. They will give the history of like this. There is a something. There is a pus formation. There is a bleeding in the like underwear. They will give the history like that one. You have to mark the answer. The fistulo-anal. Okay, now this is the guys is the chronic fissure. This is the fissure. Fissures are due to the lack of due to the difficulty of passage of the fecal matter, guys. Okay, so it is due to the chronic constipation. Okay, there is a going to the tearing the anus here. This is the sentinel. This is the sentinel skin tax. For this, guys, you have to give the metronidazole with the lignocaine. There is a one tube there. You have to do this one. Apply and then you have to do the siege bath here. This is the rectal prolapse. Rectal will be coming out. This is called as pilonidal. This is the pilonidal sinus, also called as Jib drivers. This is the ulcer here. Here is a pilonidal sinus. So okay, now this is the case of the This is the case of the we have to perform in the case of the appendicitis. Appendicitis. Okay, now you have to tell the patient to update the leg and sit up. And you have to guys press the you have apply the pressure here and tell the patient to raise. You know, this here this if there is appendicitis guys, it will give the pain to the ear. Yes, so asthma here is connected to the. Okay, 1 minute. I will switch on my light also. Why not coming? Okay, it's okay, guys. Don't worry about that one. Okay, okay. This is the obturator sign. This is the SWAS sign, guys. You have to tell the patient to do the invert, and the external and internal rotation. This is the SWAS sign, guys. This is the McBurney point. Here is the this is the Rosin sign, guys. You have to tell the patient to to cough. Okay, na? The Rosin sign. Okay. Turn for the what? Turn for the appendicitis. What is Murphy sign, guys? Murphy sign is done for Murphy sign is done for what? For the cholecystitis. Okay, cholecystitis. Remember here, this is the case of the acute pancreatitis. The acute pancreatitis. In acute pancreatitis, is the acute pancreatitis, guys. What the reason? What happened? This is the hemorrhage here. This is the acute hemorrhagic pancreatitis. This is the guys. This is the colon cut off. This is a colon cut off sign seen in the pancreatitis here. This is the chronic. This is the and also see here, guys. Chronic pancreatitis leads to the cyst formation. This is a fluid filled pseudocyst here. Okay, na? This is the complication of the chronic pancreatitis. Okay, this is the Murphy sign, guys. This is the Murphy sign. You have to press here at the right upper quadrant. Okay, now tell that to cough. You have to just okay, na? Just leave it, just rebound like this, guys. Okay, tell the patient to cough. if there is a if there is a pain, it means it is the Murphy sign positive. It's for the acute cholecystitis. This is the guys. This is the gallstone. This is the gallstone. Okay, this is the on the bladder. This is the gallbladder cancer, guys. Just remember it, guys, about the gallstone, and I think what time here. This is, guys, this is the atherosclerosis of the coronary vessels. This is the lad. So lad about this one. This is the aortic dissection. This is a tennis ball. This is the tennis ball sign. Tennis ball sign. Okay, na? Aortic dissection, guys. Here. This is the abdominal aortic aneurysm. This is there is a crescent. There is a crescent sign here. Crescent sign. Guys, remember this from the corridor. The corridor seats. Guys, just remember that this is a type 5 associated with what this is called as Caroli's. This is called as Caroli's disease. Type 5. This is the guy. This is the strawberry gallbladder as well as cholesterosis of the gallbladder here. I think everyone knows about this one. This is the examiner favorite. This is the water lily signs in the case of the hydatid cyst due to dog tapeworm. History of the petworm is a T-tube cholangiogram insert in the case of the heterogenic injury of the post-operative. Remember here, guys, this is the intraperitoneal bladder rupture, guys. This is the sunburst appearance here. Here is in the teardrop sign The teardrop sign. This is the extraperitoneal bladder rupture here. This is the neurogenic bladder. This is the Christmas tree or fire tree appearance. This is the giant bladder stone here. Giant bladder stone here. This is the Foley's catheter. This is the Foley's catheter, guys. Okay. I think everyone knows about this one, Foley's catheter, how to insert it, how to insert. And guys, here you can see this is the, I think everyone knows about this one. This is the, if they give the history of the, if they give history of the manhole, how to tell this is the anterior urethral rupture here, you know, bladder here. I think everyone knows about this one. Okay, na? They will give the history of the, yeah, like a person is going and he fell down in the manhole, or he got the injury. Okay, na? Is it anterior or posterior? I think everyone knows about this one. Case you studying the anatomy also. Okay, just do go ahead. This is the thimble bladder seen in the bladder. This is the bladder. It's a butterfly. This is a butterfly hematoma seen in the anterior rupture. Okay, now the most common is the membranous. The most common injury is the membranous urethra. Now bulbar. Okay, now the most common injury is the bulbar urethra, guys. Remember, okay. See, this is the renal tuberculosis. It's a moth eaten calyces. See in the renal tuberculosis. It's the putty kidney here in the renal tube. This is the putty kidney. Okay, this is the, see guys, this is the papillary necrosis. It's the egg cup appearance. It's the egg cup appearance. Egg cup appearance is in the case of the papillary necrosis. This is the guys. This is the medullary sponge kidney. It's like a paintbrush appearance. See guys, yeah, there's some pictures of the, like, from the nephrology. Just remember, this is the, I think everyone knows about this is the emphysematous. There is a emphysematous what? It means that there is a airfield in the pyelonephritis, in the pyelo. This is the staghorn. This is the staghorn or struvite calcus. It is in the TPS, is the triple phosphate stones. This is the horseshoe kidney or hand joining signs in the, or flower vase appearance. Horseshoe, guys. See, this in the BPH, is the bilateral fish hook ureter. Bilateral fish hook ureter is in the case of the BPH. The unilateral fish hook is the S shape in the retroscavical. This is the cobra head. It is cobra head. In the ureterocele. Nephrosis. This is the renal cell carcinoma. You see the clear cells. This is the type 1 papillary. This is type 2 papillary. These are the chromophobes. This is the chromophobes, guys. This is the collecting ducts. Is the medullary. Clear cell carcinoma is the most common cancer of the kidney. Next one, guys. This is the prostate, guys. Is the outer zone is the highly responsible. It is the highly responsible for the BP. This is the for the BPH, guys. Okay, this is the outer zone is the most commonly outer zone. Okay, guys, this is the osteoblastic metastasis. See in the prostate carcinoma, and also, guys, here this is the TURP. This is the prostate. This is the transurethral resection done in the case of the BPH, guys. This one. This way everyone knows about this one. This is the penile squamous carcinoma. This is the foreign gangrene here. The bell pepper deformity seen in the case of the torsion here. And this is the guy. This is a phimosis. Phimosis means we can't retract the skin. And this is the paraphimosis. It means the skin will not go back, will not retract back. Okay, hyperspad. This is the one. Uh, think everyone knows about this one. This is, guys, this is done for the hydrocele, guys. Hydrocele is the transillumination test positive there. Here, hydrocele. This is the catgut switches. I think everyone knows about this one. Catgut switches is the viral switcher. This is the combination used for the skin grafting. This is the unipolar category. This is the bipolar. This is the bipolar, guys. See, bipolar. This is the unipolar category. This is the hypertrophic scar and the key. This is the killer, guys. Killer will crosses the wound limit, and this is the will not cross. For the killer gas, you have to do the triaclominine, triacelamine. You have to give the treatment injection, guys. Here, guys, is the zone. Zetobetonia, zone 1 and zone 3 require the exploration. This is the dermocyst. This is the sebaceous gland, guys. Remember the some important instrument. This is the proctoscope. This is the proctoscope, guys, for the hemorrhoids and the rectal polyps, and contraindicate in the anal fissure because it is the anal fissure. It is the bleeding. Okay, na. Detail force up here. This is the myos or towel clip. This is used to fix the surgical traps here. This is the versus needle. Okay, to do the peritoneum here, to go the pneumoperitoneum to get pneumoperitoneum for the laparoscopy surgery, guys. This is the Babcock's here. This is the Babcock's here to hold the delicate structures here. Ellis forceps, guys, to hold the tough skin here. It's gonna tough skin is the see here. And next one is the, as you can see here, we have in the this is the Duane's retractor for the to retract the urinary bladder here, guys. And the important one is the Duane's retractor. Okay, just remember, just try to identify the. Oh my goodness, what happened? What happened? Okay, okay, guys. Okay, yeah, there's some important. There are some important instrument, guys. As you need to remember, guys. Okay, I think I'm done with the images. Thank you very much. I think okay now. So guys, it's okay. Just try to remember these all images from the surgery, guys. That's all from my side. Okay, I will share this PPT in the group. Okay, thank you very much.